If I told you there was an intervention that lowered blood pressure, reduced blood sugar after meals, decreased arterial inflammation, and improved cardiovascular recovery, and that it took 10 minutes, required no equipment, and could be done by almost anyone over 60, regardless of fitness level, you would assume I was describing a medication. I am not. I am describing a 10-minute walk after each meal, not 30 minutes on a treadmill, not a gym membership, not a structured exercise program. 10 minutes of walking after breakfast, 10 minutes after lunch, 10 minutes after dinner, 30 minutes total, spread across the day, and in the published evidence, more effective for certain cardiovascular outcomes than a single 30-minute session. My name is Dr. Emmanuel Osei. I'm a cardiovascular surgeon with over 2 decades in the operating room, and today I'm going to show you exactly why this 10-minute habit protects your heart better than most people realize, and how to make it work tonight. Stay with me. Before I explain the mechanism, I want to be direct about something. Most cardiovascular advice given to older adults centers on what to avoid. Stop eating this, stop doing that. Stop taking this medication without asking. Stop ignoring that symptom. This video is about something you can add. Something simple, free, and immediately available to almost every person watching this. That matters. Because sustainable heart health is not built only on restriction. It is built on adding positive habits that compound over time. The 10-minute post-meal walk is one of the most evidence-supported of those habits. Here is the first mechanism: postprandial glucose control. Every time you eat a meal, particularly one containing carbohydrates, your blood sugar rises as the meal is digested and glucose enters the bloodstream. Your pancreas releases insulin. Your cells absorb the glucose, and blood sugar returns to normal. After 60, this process becomes less efficient. Insulin sensitivity decreases, glucose stays elevated longer after meals, and repeated postprandial spikes, high blood sugar in the hours after eating, contribute directly to arterial inflammation, endothelial damage, and accelerated cardiovascular disease. A 10-minute walk within 30 minutes of finishing a meal uses glucose actively. The muscles working during the walk absorb glucose directly, without requiring insulin. This mechanical glucose clearance flattens the postprandial spike significantly. A study published in the journal Diabetologia compared 3 10-minute walks after meals against a single 30-minute walk at another time of day. The 3 short walks produce significantly better postprandial glucose control than the single longer session. The timing is what makes the difference, not the duration. What to do? Within 30 minutes of finishing each meal, walk for 10 minutes at a comfortable pace. You do not need to walk fast. A gentle stroll is sufficient to activate the glucose clearance mechanism. A short loop around the block, walking in place during a television commercial break, or a walk to and from a destination near your home, all equivalent. Here is the second mechanism: post-meal blood pressure management. Blood pressure naturally rises slightly after a meal, as blood flow is redirected to the digestive system. In people with hypertension or arterial stiffness, this post-meal pressure increase can be significant, sometimes adding 10 to 15 points systolic on top of already elevated baseline. Light walking after meals attenuates this post-meal pressure rise through 2 mechanisms. It increases the demand on peripheral muscles, redistributing blood flow away from the digestive system and reducing the pressure increase. And it promotes the release of nitric oxide from arterial walls, the natural vasodilator that tells arteries to relax. The combination produces meaningful blood pressure reduction in the 2 to 3 hours following meals, exactly the window when post-meal hypertension is most significant. What to do? For people on blood pressure medication, track your readings 2 hours after meals on days when you walk post-meal versus days when you do not. The difference in your own data will be more persuasive than any clinical study. Here is the third mechanism: arterial stiffness reduction over time. Arterial stiffness, the progressive hardening of arterial walls that underlies most cardiovascular disease after 60, was long considered irreversible. Once the elastic tissue in arterial walls is replaced by collagen, it does not come back. The more accurate picture, which the research has clarified over the past decade, is more nuanced. Regular physical activity, even low-intensity activity like walking, promotes the continued production of nitric oxide in endothelial cells lining the arterial walls. Nitric oxide not only relaxes arteries acutely, it signals the arterial wall cells to maintain their structural health. Regular exposure to this nitric oxide signal slows the rate of collagen accumulation and preserves more elastic function than sedentary behavior. Walking after meals does not reverse existing arterial stiffness, but it creates, 3 times daily, a period of nitric oxide production that cumulatively slows the progression of further stiffening. Over months and years, this is the difference between arteries that age slowly and arteries that age rapidly. What to do? Consistency matters more than intensity here. 3 10-minute walks every day, maintained for 6 months, will produce measurable improvements in arterial stiffness markers, pulse wave velocity, augmentation index, that a sporadic 30-minute gym session will not. Here is the 4th mechanism: cardiac recovery improvement. Your heart rate recovery, how quickly your heart rate returns to normal after mild exertion, is one of the most reliable markers of cardiovascular fitness and cardiovascular risk. A heart that recovers slowly from mild effort is a heart under chronic strain. Regular low-intensity walking trains the parasympathetic nervous system, the rest and digest system that slows the heart after activity. With regular practice, the parasympathetic response becomes stronger and faster. Heart rate recovery improves. Resting heart rate decreases slightly, and the overall autonomic balance of the cardiovascular system shifts toward a healthier, lower-risk state. This is the mechanism behind the observation that regular walkers, even slow, gentle walkers, have significantly better cardiovascular outcomes than sedentary adults of the same age and the same medication status. What to do? Notice your heart rate during and after your post-meal walks. Over 6 to 8 weeks of consistent practice, you should notice that the same walk requires less effort. That reduction in perceived effort reflects a measurable improvement in cardiovascular fitness. I want to tell you about a man I'll call Thomas, 73 years old, retired accountant. He had been told by 3 different doctors to exercise more. He had tried the gym twice and stopped. He found structured exercise programs boring and painful on his knees. He felt like he was failing at something that everyone else seemed to manage easily. I suggested the post-meal walks, specifically because they required nothing. No special clothing, no gym membership, no motivation to drive somewhere and work out. Just standing up after dinner and walking around the block. He tried it for 2 weeks skeptically. At his 6-week follow-up, his fasting glucose had dropped. His average blood pressure over the previous 2 weeks was lower than any reading in the past 3 years. He had lost 4 pounds without changing his diet. He told me something that shifted how I think about prescribing exercise to older patients. He said, "It does not feel like exercise. It feels like a walk after dinner. I can do that forever." That is exactly the point. The best cardiovascular intervention is the one you will actually do, consistently, without requiring willpower or a gym bag. A 10-minute walk after dinner, every night. That is the prescription. Let me bring this together. 1. Post-meal walking reduces postprandial glucose spikes by activating direct muscle glucose uptake. No insulin required. 2. It attenuates the blood pressure rise that follows meals through nitric oxide release and redistribution of blood flow. 3. Regular low-intensity walking slows arterial stiffening over time, the fundamental driver of cardiovascular aging. 4. It trains the parasympathetic nervous system, improving heart rate recovery and overall cardiovascular autonomic balance. Start with the evening walk, just the one after dinner, tonight, for 2 weeks. Then add the others. 30 minutes spread across the day. No equipment, no prescription, no cost. I want to hear from you. Have you tried post-meal walking before, and did you notice a difference in how you felt? Tell me in the comments. I read every single one. If this video gave you something useful, share it. Not for me, for someone in your life who has been told to exercise more and has not found a way to start. Send this to them. The barrier is 10 minutes after dinner. Everything I've shared today is based on current cardiovascular research and my clinical experience as a cardiovascular surgeon. This is general information, not personal medical advice. Always consult your own doctor before starting any new physical activity program, particularly if you have existing cardiovascular conditions. Take care of your heart. It has been working for you every single minute of your life, without ever asking for anything in return.